Hello, my name is Angie Neal and I'm the Speech Language Pathology Contact for the South Carolina State Department of Education. Thank you so much for allowing me a few minutes to talk with you about referral and eligibility for a speech language impairment. Let's start with the definition. What is a speech language impairment? Well, according to IDEA, there are 13 categories of disability. Speech language impairment is one of them, similar to autism, specific learning disability, and other health impairment. However, a disability in the area of speech and language refers specifically to a communication disorder. So a student could have one kind of communication difficulty or a combination of difficulties. This is the federal definition. It states that a communication disorder includes stuttering, impaired articulation, a language impairment, or a voice impairment that adversely impacts a child's educational performance. Now that phrase, adversely affects a child's educational performance, is important to be aware of because this is what makes speech therapy services in schools different from speech therapy services in any other setting, such as home health or private speech therapy. Because in order to be eligible for speech therapy services in a school, there must be data that indicates that the speech difficulty is having an adverse educational impact. Now, let me briefly explain each of these areas. First, let's talk about speech sound disorders. There are two types of speech sound disorders. First, speech sound disorders can be the result of substituting a sound, omitting a sound, adding a sound, or even distorting a sound. This is what we commonly refer to as articulation. For example, when a student says wabbit for rabbit. Speech sounds can also be an error because of a pattern of errors. These are referred to as a phonological process because phonology refers to the sound of language separate from their meaning. So a pattern of consistently leaving off sounds at the end of a word, such as saying fra for frog or sta for stop, that's a consistent pattern. So we would refer to that as a phonological process. Now, when thinking about what sounds do children have by a certain age, this information is here on a slide for you. These are the most current age expectations. However, there is 6 months really on either side because children don't automatically turn age 4 years and 3 months and have the V sound. So these are the expectations, but this is only one piece of data that when we consider when looking at eligibility for speech therapy services, we have to gather additional data to support the presence of a disability. In other words, and to be very clear, not being able to say certain sounds by a certain age is not enough to answer the question, does the student have a disability? As you see on the right, that is one of two parts. One, we have to determine the presence of a disability, and we have to document adverse educational impact. Here's a few things to consider when looking at speech sound difficulty. We have to consider the number of speech sounds in error, which sounds are error, and where those fall in terms of developmental expectations. And generally speaking, 3 or more errors, those would be considered as likely having a significant impact on a child's ability to be well understood in the classroom. But we also need to consider how stimulable they may be to make those sounds. And if they're stimulable, some of the time, which is about 30% of the time, those sounds are likely to undergo change without direct intervention. And again, errors must have an educational impact, such as not being able to be understood, difficulty spelling words with those sounds, or even avoidance of speaking in class because of those communication difficulties. We must also give consideration for multilingual students and those students who speak with a dialect. If the sounds that are of concern are actually not present in the student's native language or dialect, these would not be considered as being an error. For example, Spanish does not have the voiced and voiceless TH sounds, such as in think or z as in that. Therefore, if those are concerns you have, those are not something the speech language pathologist would be considered as being disordered because they've not ever heard them or spoken them in their native language. And the role of a speech language pathologist is not to make a student sound like a general American English speaker. And cultural and linguistic differences do not constitute a disorder. Now let's talk about language. There are 6 areas of language. There's semantics, which is vocabulary, morphology, which is the smallest unit of meaning in words, such as plural s, past tense ed, all of those different morphemes. Syntax is the rule system for how words are combined into phrases, clauses, and sentences. Phonology, as we mentioned, is the smallest unit of smallest unit of sound in language, and pragmatics is the use of language, knowing what to say, how to say it, and when to say it. And narrative and discourse is that ability to speak more than just sentences, to carry on conversations and to tell stories to other people. In terms of what to consider when looking at language, similar to speech sound development, only one or two weaknesses or one or two areas of weakness in language that would not likely have a significant impact on speaking and understanding language and would not constitute a disability under IDEA. However, comprehensive difficulties with language across all or most of the areas of language, that would likely have a significant impact on a child's education. But these must be measured using a variety of assessment tools and strategies, including observations and the data that is shared by teachers about what they're seeing happen in the classroom. So for example, if a student struggles to answer a question quickly and easily, similar to what most students are able to do effortlessly, or if they have a lot of difficulty grasping new concepts and new information and material, if they have difficulty with written composition or reading comprehension. And two, we must give consideration to multilingual and students who speak with a dialect, because languages differ from General American English in terms of phonology, morphology, and syntax. And these are differences that we need to respect. So if we hear them, we need to make sure that those are not due to not having heard those in their native language or dialect, because that would not be considered as being an error. Also, before making a referral, it's important to know that the child cannot and must not be determined to be a child with a disability if the reason is because they have not been provided appropriate instruction in reading. This includes systematic and essential components of reading, meaning explicit and systematic instruction in phonemic awareness, phonics, vocabulary, fluency, and comprehension, as well as lack of instruction in math, limited English proficiency, cultural factors, and environmental or economic disadvantage. Again, we need to collect data to make sure we're not doing that, because lack of instruction, being poor, or speaking another language, that is not a disability. As far as fluency, this is referred to commonly as stuttering, and it's characterized by speaking with an atypical rate or rhythm. This may occur when speaking sounds or syllables or words and phrases, and a student who is disfluent may demonstrate really excessive tension or even struggling behaviors or avoidance of speaking. So the SLP, the speech language pathologist, when looking at fluency, will need to gather a variety of data, including observations across varied contexts, and include your information as a teacher about the difficulties that you're seeing. Some consideration should also be given for young children when there's concerns about fluency, as they go through or may go through a period of what's referred to as normal disfluency. This occurs between the ages of 18 months and 5 years, and they have disfluent-like behaviors. They're more characterized by things like whole word repetitions or phrase repetitions, and for the most part they're not aware of it or even bothered or concerned by it. But if this goes on for an extended period of time, then that may be a signal to look more deeply at their needs. But regardless, when you see a student who is struggling with their fluency, please always allow them to complete their thoughts and never interrupt them or complete their sentences for them. And two, we must give careful consideration to multilingual students so that we're looking to see if the disfluency occurs in both languages or if they're disfluent or have disfluent-like behaviors while they're acquiring a new language. And again, they must have an adverse educational impact, such as difficulty communicating in small or large groups, difficulty speaking or avoidance of certain speaking situations, and when the student has significant concerns about their own communication. Voice, well, this one is very varied. So voice difficulties could be due to pitch difficulties, speaking at too high of a pitch or too low of a pitch, difficulty with vocal quality, such as speaking with a voice that is too hoarse or even too breathy, or difficulty with vocal intensity, really referring to are they speaking too loudly or softly, as well as difficulty with resonance, which is pretty technical, but it generally refers to how that air is passing through the appropriate parts of the vocal mechanism. Now, because voice disorders are very specific to the vocal mechanism, a child must be seen by an otolaryngologist or ear, nose, and throat specialist in order to look at those structures and make sure that there are not anatomical reasons for the difficulty. And to do that, there must be special instruments and equipment used that speech-language pathologists in a school do not have. Also, there are some medical conditions that require supports or interventions or even surgery, and without those things, speech therapy alone will not improve the child's voice. We should also consider that voice difficulties are not really a voice difficulty if they're related to temporary factors, such as a short-term illness like a cold or a sinus infection or even an allergy, or short-term vocal abuse, such as being hoarse after yelling at a football game, or even puberty. And these voice disorders may have an adverse educational impact, such as really not being able to communicate effectively. Now, what to do if a parent requests an evaluation? Well, federal regulations allow a parent to request an initial evaluation at any time. And when a parent makes this request, the school team must meet in a timely fashion to discuss these concerns and determine next steps. This does not always mean an evaluation will take place. Sometimes more information needs to be gathered. Sometimes it may mean that that information that is gathered does not support a disability that has adverse educational impacts. So what to do when making a referral? When should we make a referral? Well, anytime you suspect that a child is a child with a disability that has an adverse educational impact, that constitutes an appropriate referral. The referral for speech language impairment should not be dissimilar to any other referral for a suspected disability. In other words, they should follow the same process as all areas of suspected disability. And this is important because in doing so, the team is required federally to review all the information in order to provide an evaluation that is sufficiently comprehensive to identify all of the child's needs, whether or not they're linked to that initial area of concern. So, when making a referral, talk with the parents first. See what their concerns are. See if they share the same concerns. Also, use the referral process according to your school and district procedures, including that data and information about your concerns that you're seeing and the educational impact. Also, have the person in charge make sure the SLP knows to do an observation of the student and that they will schedule a meeting. And in that meeting, both the teacher and the speech language pathologist and any other appropriate staff can discuss those observations. Then that team as a whole will look at all of the data, do some problem solving, and then determine the appropriate next steps. In order to be eligible for speech language services under IDEA, actually all services under IDEA, the team must answer yes to both of these questions in order to become eligible and to remain eligible. The first question is, does the student demonstrate or continue to demonstrate a disability? The second question is, are there adverse educational impacts that are in need of specially designed instruction to address the unique needs as a result of that disability in order to ensure access to general education and meet the educational standards that apply to all children? Finally, let's close up here by talking about and reminding each other that the presence of a communication difficulty alone is not enough to qualify as a student with a disability in the school setting, according to federal regulations of the Individuals with Disability Act. There must be data that supports that the communication difficulty adversely impacts the child's educational performance. Also, as we've discussed, multilingual students and students who speak with a dialect require careful consideration in order to respect those linguistic differences. And Communication and collaboration is so incredibly necessary to make sure that we have all of the appropriate data to meet the child's needs as well as to determine eligibility and ongoing eligibility. Thank you so much for your time and attention and for what you do for students every day. Please reach out to your school's speech language pathologist with any additional questions.